Good. All right. Thanks, Terry. All right. Okay, good evening, everyone. I'd like to call to order the King George County School Board regular meeting. Please rise for the pledge of the flag. Sorry, pledge of allegiance, followed by a moment of silence. Shaw.
Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, please be seated. All right, at this time, we will move on to public and employee comments. So I'll ask that you please state your name and address, and in order to afford everyone an opportunity to speak, we ask that you limit your comment to 3 minutes. So I will start with Mr. Chance Puckett.
Thank you. I'm speaking on behalf of all the parents here in King George, and I would like you to know we really do appreciate that you are not going to send these kids back with masks on all day long. I understand they do have to wear them on the bus, and I don't know about other parents. I'm okay with that, but I just want y'all to know really what kind of a joke it is if you were to have these kids in class wearing these masks all day long. Everybody here knows that they're not effective. They don't do anything long term, and that these masks are saturated after 20 minutes. I don't know how many people knew that, but you would have to have 3 sets of masks per hour per child for them to remain effective all day. And if y'all hopefully continue to keep them mask free and keep them from having to rebreathe their own carbon monoxide, we certainly would appreciate that. Thank you.
All right, thank you, Mr. Puckett. All right, Mr. Vance, do we have a comment online? 5, all right. Okay, it looks like first we've got Ms. Amber Kintz.
Hi, can everyone hear me? Okay,
Yes.
Thank you for allowing me to speak this evening. My name is Amber Kintz. I live at 14368 Chasteen Drive, King George, Virginia. I have a stepdaughter who's going to be 16 and a sophomore at King George County High School, as well as Chesapeake Bay Governor School. I can assure, I didn't hear if it was Puppet or Poppet, that he doesn't speak for all parents. Masks have been proven to be very effective at reducing COVID, and each mask is effective for up to 4 hours. The only masks that actually reduce your ability to breathe are N95s. Most people aren't even wearing those. Plus, we have a county that has just over 26,000 people in it, but less than half of our county is fully vaccinated. I'm also curious, given the current recommendation that from the school board, I apologize for my toddler, that the students don't have to wear masks. How is a teacher going to remember to ensure that if a student should be masked because their parents want them to be during the school day, to make sure that that student remains masked? if the student takes their mask off to take a drink of water or eat lunch, the teacher needs to ensure that the student puts their mask back on. And I see this in the same vein as making sure that a student receives their insulin injections or their albuterol if they happen to have asthma. And I do see it completely as the teacher's responsibility. So I see personally that you're actually, even though some of the teachers seem to be celebrating that there aren't going to be mask requirements, I see this as making the teachers' jobs more difficult. And I also believe that, as Dr. Fauci and Dr. Rachel Walensky have said, we are going in the wrong direction with COVID, because this is now a pandemic of the unvaccinated. So we're likely to be under another mask order probably by the end of September or October. And I'd also like to know, what's the school board's plan for when children or staff eventually get COVID? And I mean, we don't even use the emergency bus routes during the winter months because we're so afraid of just one person getting hurt or killed.
Okay,
So how
that's
does
been through.
that affect COVID?
All right, thank you. Next, we have Lillian Brown.
Hi, I hope everyone can hear me.
We can hear you.
Okay, thank you. My name is Lillian Brown. I live at 1130 Garner Drive in King George. I'm commenting this evening to add my support to those of us in the community who are asking that masks remain optional for the students and staff for the 2021-22 school year. An opinion piece published in the July 21st edition of the Wall Street Journal with Dr. Macquarie, a professor at the Johns Hopkins School of Medicine, Bloomberg School of Public Health, and Carey Business School, writes that her research team at Johns Hopkins worked with a nonprofit group, Fair Health, and found, quote, a mortality rate of 0 among children without pre-existing medical conditions such as leukemia, end quote. So for families in our community that are uncomfortable with sending their child to school without a mask, there are wonderful options. If we stick to the facts about how this virus impacts children, it's safe to say that we're at the right time to move forward together, bring children back to school, masks optional, where we're able to reassure them of the fact that the health emergency in our area is over. Thank you.
Thank you, Ms. Brown. Next, I believe Moses Willoughby, if I read the slide correctly. Are those two?
Hello. Yeah, I'm sorry, I was muted. Can you hear me?
Yes, we can hear you.
Thank you very much for taking your time to hear the members of the community. I live at 10503 Wallace Drive. I'm actually happy for Mrs. Brown and the other gentleman that actually spoke up and researched that masks are absolutely detrimental to a young person's mind. You cannot deprive a young brain, you cannot deprive anybody's brain of oxygen for so long without brain damage. We've been doing this for a year and a half. Our kids are ready to go back to school. I have one that has bronchitis and he has really bad asthma. He just can't wear a mask at school, so it should absolutely be optional. Mrs. Kins obviously has not done research. Masks are definitely detrimental. I do not listen to the news to tell me what is right and what's not. I actually do the research like Mrs. Brown and the first gentleman, and I really think that it should be optional, and I appreciate you guys for your time. Thank you.
Thank you. Next, we have Tamara McDowney.
Hello, can you hear me?
We can hear you.
Hi, this is Tamara McDowney. My address is 5948 Parsons Lane, King George, Virginia. My stance on this is I would prefer all students and teachers to wear masks for the safety of others, especially given the fact that most elementary school children aren't even eligible to receive vaccinations, such as my son, he's in the 3rd grade. And I have 2 young toddlers at home, and I both have high-risk parents. And I just don't want to take that risk in sending my child back to school with the potential that he may bring something home. I had registered my son to go back to school in person prior to the cutoff date where they were requiring masks, and now they are not. So my main thing is if masks aren't going to be mandatory, is there a way to change my son's enrollment from in person to virtual? Thank you.
Thank you. Ms. McDowney. Next, we have Susan Park.
Thank you. Thank you. Can you hear me?
We can hear you.
My name is Susan Park. I live at 10064 Francis Folsom Drive, and I have 2 children in the King George County school system. My younger daughter is 9 and cannot be vaccinated yet. And while I know younger children are at less risk of serious illness and death from COVID, there's still risk. And masking has been shown to work in reducing COVID transmission and is completely safe. And I feel we should continue masking, at least in the elementary schools. Even one King George child becoming seriously ill or dying from this illness would be too many, because it's preventable through masking, sanitizing, and ventilation. So I support the use of masks in the schools, and I would like to ask the board to reconsider and make masks mandatory, at the very least for the elementary schools. We all want our kids in school this year, but if the COVID rates rise, which they undoubtedly will, if we make masks optional, schools will be closing because there will be a spread of illness and teachers and staff will be out sick. And that's a greater disruption to the education of our students than would be otherwise. So I see no downsides to mandatory masking. There are only benefits: decreased COVID spread, less chance of school closures and staff and teacher illnesses, and less risk of illness and death for our youngest students. So I ask you to reconsider. Thank you.
Thank you, Ms. Park. All right, at this time, do we have any changes to the agenda?
Sorry, no changes, Madam Chair.
That's all right. Moving on to our consent agenda. This evening, we have for consideration the minutes from the July 12th, 2021 regular meeting. Do we have a motion?
Motion to approve the July 12th, 2020 regular minutes.
Second.
Any discussion? All in favor?
Aye.
Chair votes aye, motion carries. Moving on to our action items, we have a number of policy manual updates that have previously been reviewed for approval this evening. Do we have an action?
Make a motion to approve the policies as presented.
A second.
Any discussion? All in favor?
Aye.
Aye.
Ms. Pansier, I'm sorry.
Aye, I'm sorry.
Okay. Chair votes aye, motion carries. Moving on to our discussion items. So we have a number of policy manual updates. Again, I'll walk through them. If there are comments or questions on any of them, please speak up. So first up this evening, we have policy AC, non-discrimination. Policy AD, educational philosophy. Policy AE, school division goals and objectives. Policy CH, policy implementation. Policy GCL, professional staff development. Policy IA, instructional goals and objectives. Policy IGAI, character education. Policy IGBC, parent and family engagement. So Dr. Benson, I have a question about this policy. On page let's see, it's page 4 of the policy, page 42 in the packet. It states that the school board conducts an annual evaluation of the content and effectiveness of this policy. I was wondering, we do that? Or have we done that? So it's the last page of the policy. GBC.
Yes, I believe this section of the policy, I believe is referencing Title I. So that there's a standing committee for the board, advisory committee for the board, composed of, in part, of parents. So that's one avenue, and I believe annually they do come to this board to deliver an update or an annual update for Title I.
Okay, so it's the, I'm sorry, looking at it. Okay, so the evaluation done by the committee, not necessarily our review of the committee or the policy itself.
Correct. You could certainly, instruct that committee as an advisory committee to the board any way you want as far as additional information if necessary, but that does satisfy this aspect of the policy.
Okay.
There's an additional parent survey that that Ann Bush sends out every year. I think it's on the website now, for family and parent engagement information also. So,
correct. That's germane to students with special needs or family with special needs.
Yes.
This part of this policy questioning, I believe, talks about Title I, Part A.
Oh, okay.
As hers would be Title VI, Part B.
Okay.
Okay, thank you. All right, next is policy IICA, field trips. And so I have a similar question about that one. On page 1, the first page of that, I guess the only page. Let's see, it says that the superintendent makes an annual report to the school board on the trips taken during the year. Do we do that?
We have not done that. I know some time ago there was simply a listing that we keep of field trips that we're happy to provide the board. Or we have not, to my knowledge, particularly last year, of course,
right.
Probably the better part of the year before, but we can resume distributing that to the board if we'd like. Just a listing of the field trips taken.
I was curious, since in the policy. Okay. All right, next policy IJ, guidance and counseling program.
My only comment is that somebody needs to update the title. Guidance is no longer the appropriate term. It is a counseling department and counselors, and not VSBA, the National Counselors Association updated it some time ago. Is this our wording? I mean, it's been there forever, and I dealt with it when I was supervisor, but I would like to see it just become counseling.
I can pass that feedback on to Virginia School Board Association.
Thank you.
It's their nomenclature that we use.
All right, next is policy INB, teaching about controversial issues, which I believe is was returned to us from last meeting. Yeah, Mr. Collins, did you have anything you wanted to discuss with regards to that one? No. Okay. All right, moving on. Policy JB, equal educational opportunities, non-discrimination. Policy JFC, student conduct. Policy JFHA/GBA, prohibition against harassment and retaliation. And policy JOA, student transcripts. All right, so I suppose without further comment, I suppose Dr. Benson, these will return to us for approval on the 9th.
Will do.
Okay. All right, moving on to our information items. Do we have any committee reports this evening? Ms. Pantiera? Ms. Hawk?
No, ma'am.
Mr. Collins?
No, ma'am.
And I have no committee reports either. All right, so Dr. Benson, our superintendent's report.
Thank you, Madam Chair, members of the board. Some good news to share, and the board asked about this last meeting. So I had Ms. Davis join us this evening. Good evening, Ms. Davis. Ms. Davis is the heads up our school nutrition services. And again, I'll repeat that, since March 13th of the year before, I need to remind me of the number, but it was at our meeting the other day, you rattled off a number of meals served since this began.
We are right a little bit over 700,000.
700,000 meals assembled, distributed, and driven, available for pickup. Yes. And so as we learned last meeting, because of the fees that need to be approved annually, question was brought forth since there was no fee listed next to the school meals. And I kind of stole Ms. Davis's thunder a little bit in that I let it out that the meals will be available, both breakfast and lunch for students, all students, at no cost this year, thanks to a grant from the USDA, correct?
Correct.
So I know Anita has just a couple of slides to share with this good news. As she does that, I'll pass down the dais. This is a flyer that has been created that'll be available to distribute at the beginning of school, and we'll also post up on our website and school websites for families to learn of this service. But with that, Ms. Davis, again, thank you for your service and all the service of all of the employees, food service, transportation, everybody who pitched in to make the distribution of those meals possible. I know our community appreciates it greatly.
Yes. So first of all, yes, all meals are free. They will be at no charge. There is nothing that parents will have to do. We won't be doing applications. Although online, we are going to have applications, but those applications are for people to receive the PEBT. Which is additional money put on their cards through social services. So we will be still collecting those, but we won't be distributing applications throughout the school and killing a million trees like we normally do. So for the year 21-22, school meals will be free. The USDA extended the meal flexibility to go through June 2022, which will allow all of our students at no cost to receive breakfast and lunch. So this is so short and sweet. I am so excited about this. I'm scared, but I'm excited. So we have the flyer that you have in front of you now. It's going on the division website. We're going to put it on social media, and then we're just relying on word of mouth. At every open house, we will have someone there to talk about, because parents are still calling, well, what do we need to do? And they don't need to do anything. Just tell their kid to eat breakfast and lunch. That's it.
Ms. Davis, do you want to clarify about a la carte items or those types of things?
So a la carte, we are not going to be doing a la carte, selling ice cream or any of that until January. When the shutdown happened in March, we were left holding a lot of ice cream. And so I'm just going to wait. I'd rather be safe than sorry. So we're going to wait till January, let them get used to eating nutritious meals before we start throwing in all the healthy snacks.
There will be some a la carte available, is that correct? But that would be a charge.
Right, that will be a charge. Students will be allowed to buy extra fries, extra slices of pizza. They will be allowed to do that. We're just not going to have like the smoothie machines and all that stuff, especially that we have at the high school, because really with the number of students at the high school, it's going to be basically impossible to make sure they get a meal as well as get a snack line going.
So why is that? Is that because you expect more kids to eat?
Yes, indeed.
Because it's free?
Yes, we
Okay.
expect more kids to eat because so many families have taken advantage of the curbside. So they're used to it. They're used to the no charge meals. So, and I'm thinking that the way we're going to be pushing and publicizing this, that we are going to get a lot of students who won't be, that we have a lot of students in the county definitely that cannot afford meals right now. So this is coming as to help us not have debt, because I think if we did go to the National School Lunch Program where we charge, we would be probably receiving double the charges that we have in the past.
Okay. And when you mentioned earlier about the, I guess, the applications that folks can still submit for the PEBT,
Yes.
is that for the students to use to purchase the additional a la carte items since the meals are free, or how does?
No, the PEBT is for parents, and they can use that to go to the grocery store.
I see. Okay.
Yes.
Okay.
It's just like the normal EBT card. It's called a PEBT card because it's a pandemic card. So it's just additional money that's put on their cards.
Okay, but the applications go through the schools?
They go
sort
through
of?
the schools the same as we have in the past. But the bulk of the people that are on it receive direct certification from social services. So we don't get that many kids because a lot of people have gone through social services, which automatically will put them free in my system.
Right. All right. Thank you.
One other note, I remember we spoke about supply and that we ask everyone's patience and understanding. We sometimes might need to be flexible menu-wise because of the uncertainty of some of the supply, like chicken, some other.
We have lost a lot of chicken vendors because chicken seems to be what's a shortage right now. So we normally have 5 different vendors. We have 2 vendors this year. And both of their prices in the bidding puts them right there with beef. So we're going to be paying a pretty penny for chicken nuggets. And there are a lot of things that we're seeing during the pandemic that we couldn't get. A lot of companies just folded because they couldn't get the product to supply us, like something like corn dog nuggets. That was something that was so hard to get this summer. And so we've had to reach out to another company to see if they would bid and supply us. But it is a lot of products. The number one thing is shelf-stable milk. We try to keep a lot of that because what has happened during the summer is Pet Dairy couldn't supply us. They didn't have the milk. So we would have to resort to the shelf-stable milk, which at that time was great, but now I can't get any. So if Pet goes under this time, we are going to be in a lot of trouble because those meals have to have milk.
Interesting. All right. Any other questions for Ms. Davis?
Thank you, Ms. Davis.
Thank you.
Yes, thank you.
Thank you again, Ms. Davis. Second thing I have is we've had a good bit of discussion statewide and certainly in our community about the use of masks as a mitigating strategy. We learned as Virginians last week that the public health order requiring masks inside of school buildings expired without renewal, that the state now leaves locally any decision about mask policy. We have passed along the very same wording that the press release provided, and that was while masks are not required, they are certainly very strongly encouraged particularly for those students who are not fully vaccinated, and that would of course include any student under the age of 12, particularly our elementary and preschool students. So we will begin the school year with that as an option, but we do strongly encourage students utilize masks as a mitigating factor. We will continue, of course, with other mitigating strategies that we have invested in. Most notably, we've installed air ionization systems in every building. We've also installed ionization systems on school buses. And while I'm talking about school buses, the school buses or school transportation, which includes buses and cars, maintains the requirement for passengers and staff to wear masks So that requirement has not been lifted federally, as was mentioned earlier tonight. I mentioned the ionization systems. We will continue to do hand washing, have an emphasis on hand washing and proper hygiene. We will continue to be working with our partner locally to do contact tracing and to utilize quarantining as necessary, hopefully not, but as necessary. And of course, we will continue to monitor. The other strategy is to make sure that we monitor in a timely fashion any community transmission, certainly any transmission in the schools. We'll also be tracing any need to quarantine students. And should those metrics escalate, I could very easily, or I'd need to prudently bring back to the board that information and make available to the board for consideration in terms of masking as a mitigating strategy. So that is the update on the website for families who are listening. If you'd like to access the official information there, and I will leave it at that or open that up to any questions you may have. But that concludes my superintendent's report. Thank you.
Okay, thank you. Any questions for Dr. Benson? Oh, Mr. Collins? Anything? So Dr. Benson, I'm just wondering so I mentioned the revisiting our metrics that would potentially trigger the need to return to requiring masks. Do we have an idea what threshold or what our metrics would look like that would trigger such a decision?
No, I've not set a definitive threshold. I have a meeting tomorrow at noon with our local VDH and other school divisions, so I anticipate that'll be a topic that we'll discuss, and we'll get better information in terms of how to interpret some of the metrics that are now being continued from our local VDH, or really from the state VDH, that we can interpret locally. So I can bring that to you all. But irregardless, I'd still bring that data to you, irregardless whether there's a recommendation or not, just so that we can continue to monitor, particularly in the early weeks of school, how things are progressing. Fingers are crossed, and we experienced very little, if any, transmission when we went to in-person last year. I'll put another plug in, and we put a plug on the website that as a community, our best defense is vaccination. If you've not been vaccinated, please help us to keep our schools open. Please obtain your vaccine. For those students who are eligible, we encourage them to receive their vaccine so that we can mitigate any possible transmission, both in our schools and, more importantly, our community, since our schools are part of our community.
All right, thank you.
So, quick question, Dr. Benson. On our, I think it's on our website, but the interim guidance for the COVID prevention issued on the 25th by Department of Health is still in place. Is that correct? The structure is very, very similar to what we had originally with the matrix.
Yeah, you're talking about the way the data is collected and
Yes,
codified,
yes.
correct?
Yes, and the steps, the step one, evaluating the level of community disease transmission. And as we had earlier, it has the low, moderate, high transmission matrix. Is that what our matrix is, or are we doing it locally?
Well, we're going to collect, to answer your first part, yes, that table that you're referring to is very similar in structure to what had been
Right.
in place. Some of the step one, step two, some of that information is newer than the way the data is displayed. But we'll certainly follow that protocol as far as assessment. We'll collect, in addition to those metrics, we're going to collect, obviously cases, school division or student and staff cases.
Right.
We'll continue to collect, and we'll also collect the number of students or staff or staff that need to be quarantined to supplement the data that PDH will provide.
But that begs the supplemental question of testing. And that is one thing I'd like us to explore more about. Maybe you could bring back information to us about whether we're doing any in-house testing, or I think Mr. Collins brought that up during the course of the year. Are we going to be doing testing? Are we Or do we need to discuss testing?
Right now, we refer out, for those students who are symptomatic, as we did last spring, we would refer out to their
And staff as
provider.
well?
Yes, absolutely. But we've not discussed the feasibility or even having the capacity in addition to, as far as staffing. We're already struggling to fill
Right.
teaching positions, to fill positions, or to contract into the school testing. Right now, I'm not sure we have the capacity to do that, but we certainly do advise families and encourage them to seek testing through their physician or through a private vendor.
Okay. That's all.
All right. Any further questions? Comments? All right. Thank you, Dr. Benson, for the update. We'll move on to our board comment for the evening. Ms. Pansiera?
Just wanted to say congratulations, Mrs. Davis. I'm sure you're excited that this is behind you and you're looking forward to the next phase. I've heard a lot of wonderful things about what you've done, and we are very blessed to have you as part of our team. So thank you very much. I also want to just make a comment about the comments that we had heard tonight. Obviously, this mask mandate or non-mandate is very divisive, as is the science. It does seem to be that it's clearly divided, that some people like to go with the science that masks are much needed, and some believe that masks are a hindrance. So, I think that we can definitely argue in that regards. But the one thing that I want to say is that, as individuals, we have the choice to decide on which science, we feel more comfortable with. And, I think that since Dr. Benson had said that we use the same wording and guidance from our experts, I think that I'm pretty confident that we are moving in the right direction of making masks voluntary. I also want to just point out that the risk mitigation is individualized. And, we all can sit here and say that, I want masks for my child because of X, Y, and Z, or I don't want masks for my child because of X, Y, and Z. And at the end of the day, it's the parent's choice in order to make that decision as to what risk mitigations and what is best for their family. And I think having the mask being highly encouraged is the best way to go. I also just want to let everybody know, we don't, Dr. Benson mentioned it about our ionization, but we spent almost $750,000 in order to have that ionization system installed in our facilities. And as the Honeywell representatives noted, it's 90% effective in capturing any COVID virus. I'll never forget, as she said, as soon as it comes out of your mouth. The vaccine is 90 to 95% effective. So, it's not that I'm hanging my hat on only that, nor am I hanging my hat only on the vaccine. I think it's a combination of all of us doing our due diligence and respecting each other. So I'm looking forward to the schools opening. I think everybody is excited about getting back to some type of normalcy. I've talked to several parents and kids, and even though they're not happy that it's starting so soon in the year, August, they are looking forward to coming back. Also, thank you, Dr. Benson, for all your due diligence. I know you've been working hard this summer and attending meetings and doing your research as well. And I just want to say I appreciate all the efforts that you've put into that.
Thank you, Ms. Pansiera. Ms. Hawk?
I think my only comment is vaccination, vaccination, vaccination. And I can speak from my family. We are doing it. The children are doing it. As soon as the shots are available for younger children, they will be doing it as well in various states. I think it is a time for everyone to truly help look after your neighbor. You may not have issues that will be compromised in your home, but your neighbor may have parents or children who are in chemo treatment, who have very severe reactions. I'm asking you, please, to whatever your religion or lack thereof, to think of your neighbor and think of their children. I am very thankful for all the effort that Ms. Davis and her team has done this summer. And I do need to say a real thank you to the bus drivers who have been working sometimes behind the scenes. They're on the road. And I am concerned, Dr. Benson, that we need to think about how we can help, if we can, that there are not, at this point in time, there are very few aides on the buses consistently. And the bus driver's primary goal is to drive that bus safely from point A to point B. Making sure that children keep their mask on, however important it is, and I do believe it to be important, is going to be a task. Perhaps as much for the big ones as the little ones sometimes. So I do think we need to be aware of the extra duties that are going to fall on a number of our roles in the school system. I certainly am a believer in masks, and although vaccinated, if I'm in a congested place, then I will wear my mask. Thank you.
Thank you, Ms. Hawk. Mr. Collins?
Thank you, Ms. Davis, as always. You do a wonderful job. I didn't plan on making any comment about masks because we had already settled that last meeting. But since that seems to be going on, I will throw a few things in there. The state didn't renew that, so we had a local option not to have masks, and we chose to have optional masks. I think that we're on a slippery slope when we allow the government to continue into our families to make decisions on family matters. It's up to the parents whether their children wear masks. It's up to the parents, families, doctors, whether they need to wear a mask. So I think we need to stop the slippery slope of allowing the government to continue to mandate our family values. Thank you.
Thank you, Mr. Collins. So I will echo the sentiments of my colleagues, say thank you, Ms. Davis, for your continued dedication to feeding the children in our community. I think the last time I heard about the numbers of meals that you had provided, it was, I think, only on the order of like 3,000. So the fact that we're up to $750,000 is pretty gosh darn impressive. So thank you. I've heard a lot of really positive feedback about how much the meals meant to families this year. So thank you for all that you've done. And then while there's been a lot of feedback, we've certainly received a lot of feedback in support of the optional masks. I would like to also address those families and students who are in support of masks being required, especially for our elementary students under the age of 12 who've not yet been given the opportunity to be vaccinated. As I've stated before, I am in support of adhering to health guidance put forth by the state health and education departments. Despite the expiration of the public health order on July 25th, the Virginia Department of Health and the Department of Education continue recommending masking for all students and staff inside of preschools and elementary schools for just this reason. The American Academy of Pediatrics also advocates for all students, teachers, and staff to wear masks while indoors at school. So while I recognize it is impossible to make a decision that will please all, and that families with beliefs on both sides of the issues have in fact made decisions for their children's schooling and education this year based on the assumptions one way or the other, I remain firm in my adherence to science and the wisdom of following the advice of medical professionals as pertains to the COVID-19 pandemic. So I acknowledge that at this time, the will of the board is for masks to be optional, but I firmly expect us to revisit this, as Dr. Benson has mentioned, as our case numbers rise again due to the Delta variant. So thank you. So at this time, we can move into closed session if we have a motion.
Pursuant to State Code 2.2-3711.A.1 for the purpose of discussion, consideration of prospective candidates for employment, assignment, substitutes, and resignations of employees of the school board, and for discussion of specific employees of the school board, specifically the evaluation of the division superintendent. And pursuant to State Code 2.2-3711.A.7 for the purpose of briefing by staff pertaining to actual or probable litigation where such consultation or briefing in open meeting would adversely affect the negotiating or litigating posture of the public body, I move we enter into closed meeting.
Second.
All in favor?
Aye.
Chair votes aye. We're now in closed session. Okay, so we have a motion to return to open session.
I move that the King George County School Board return to open session and certify that pursuant to State Code 2.2-3712.d, only public business matters lawfully exempted from open meeting requirements under this chapter, and only such public business matters as were identified in the motion by which the closed meeting was convened were heard, discussed, or considered in the meeting by the public body.
Second and certify.
Certify, all in favor?
Aye.
Aye.
Chair votes aye. We're now in open session. Do we have a motion to approve the action resulting from closed meeting?
I make a motion that we accept the actions that were proposed in the closed meeting,
So the ones on the list
the ones on the list
as presented.
as presented.
Do we have a second?
Second.
All in favor?
Aye.
Chair votes aye. Motion carries, and we have a motion to adjourn.
Motion to adjourn.
All in favor?
Aye.
Chair votes aye. We're now adjourned till Monday, August 9th.